Good afternoon. I'm Jeff Kulikowski. This is a special report from News Channel 9. We're going to join Onondaga County Executive Ryan McMahon for his daily COVID-19 briefing. Here's the county executive at the On Center. Ish.
Hello, everybody.
Okay. That's good.
Good afternoon.
I like that. That was fine.
What a
It's like,
fantastic
10, 12
day for
seconds?
social
Yeah.
distancing outside. The snow has come.
Thanks.
I've never been so happy to see snow. We got some data to go over. We'll go over the data. First off, unfortunately, we put out a release earlier that today we lost our 8th neighbor in Onondaga County. Our thoughts and prayers go out to his family, and certainly this is just the reality of this virus, that once you get it, you're in for a fight. And so we're very, very sad, as many of us are in Holy Week, that we lost another neighbor. He was in his late 60s. He did have underlying medical conditions. Looking at new cases, we have 456 cases. That's up from 442 yesterday. So we have 14 cases since yesterday that are new positive cases. We have 49 individuals that are in the hospital, representing 18% of our active cases. This is up by 6 patients since yesterday. We have 25 neighbors in critical condition. This represents 9% of our active cases. Those two numbers have gone up, so those are important data points to think about. But more importantly, these are people. We need to pray for them and think about them over the days to come, and hope that they get better. A lot of different demographics related to the 49 in the hospital. When we get them, we share them with you. 25 are Caucasian, 11 are African American, 4 are of another race, 9 are unknown at this time. I've had people email me saying, why do we go over this? Why do you break that out? A person's a person. The reason is that as you study the impacts of the virus, certain communities have seen a greater impact on different ethnicities. So we break these out, we share this data. We haven't seen that impact here in Onondaga County, but that's why we're doing it, is because we get these questions, and in certain parts of the country, depending on what your background is, you've been hit harder. All of those who have died from COVID-19 in our county have been Caucasian. Again, 6 males, 2 females. A reminder about our hospital reporting. Those data points are for Onondaga County residents. Our hospitals are serving from northern New York, the Canadian border, to the Pennsylvania and the southern tier. Right now, when you look at all those counties that collectively that are really being serviced by our hospital and our healthcare infrastructure, we have 1,377 positive cases. The numbers go up. A lot of these counties weren't testing as much early on, so now they're testing more, and that's helping their numbers catch up, and they get to then go and identify and quarantine, just like we've been doing from the get-go in this process. Some good news. There are 176 people who have recovered and have been released from mandatory isolation and quarantine. We've had 22 new people released from quarantine. This is the first day where we've had more recoveries than positive cases. So when we look at this, we now have 272 active cases. That's down 9 from yesterday. 47 individuals out of our positive cases are household contacts. So out of our 456, we have 406 individual cases. That then leads to 47 contact positive cases for a total of 456. What's a contact case? That's typically a household contact where a person is essentially living with a positive case. Hence why we are always saying we need to be smart, try to avoid getting this thing, because if you get it, the chances are you're going to spread it to somebody in your home. Looking at the breakdown, we have 237 female positive cases, 219 male positive cases, 12 in their under 19 years of age, 19 and under, 98 in their 20s, 66 in their 30s, 66 in their 40s, 85 in their 50s, 65 in their 60s, 40 in their 70s, 19 in their 80s, and 5 individuals are in their 90s. Breakdown of percentage by age, 24% are under 30, 39% under 40, 53% are under 50, 72% are under 60, and 28% are over 60. Breakdown by municipality, City of Syracuse, 169, Town of Clay, 55, Town of DeWitt, 31, Town of Manlius, 30, Town of Camillus, 27, Town of Salina, 27, Town of Cicero, 24, Town of Onondaga, 22, Town of Geddes, 16, Town of Pompey, 15, Town of Lysander, 12, Town of Skaneateles, 10, Town of Marcellus, 4, Town of Van Buren, 4, Town of Lafayette, 3, Town of Atisco, 3, Town of Tully, 2, Town of Fabius, 1, and Town of Spafford, 1. Our good friends in the Town of Elbridge are holding strong, no cases to date. Our friends at the Onondaga Nation have no reported cases either. Again, our health department is in constant contact with our neighbors at the nation, so it's not that we aren't communicating with them. We certainly are. So far, there are more than 6,350 tests that have been administered. 6,050 tests have been returned, with 456 positives and 5,594 negatives. Again, 5,594 individuals in this process have been sick, but sick with something other than COVID-19. We have 300 pending tests. We received 435 tests back since yesterday. Right now, 7.5% of those tested are positive. That's gone down a little bit. We had a lot of tests come back yesterday. We only had 14 positives. The percentages for the first time went below in one day what we had been seeing between 7.5% and 8%. I think they're about 3.5% to 4% yesterday, and we got a lot of them back. 300 pending tests is the lowest amount of pending tests we've had in a long period of time. We'll see what today's demand brings across the community. Process after a positive test result. Our health department's going to contact you, check in on your health, look at your symptoms. You'll hear from your doctor as well. And then they're going to start their investigation of direct contacts to determine who needs to be in a quarantine or not. Quarantine is based off of direct contacts. Because you work at the same employer doesn't mean you had direct contact with that individual during the period of time that the health department is deemed necessary for a quarantine. A reminder, anyone who has been tested must be in a quarantine. For context, those 300 pending tests, those individuals are all in a quarantine. This helps us prevent those 300 individuals from going out and about in the community and potentially spreading whatever it is they have, whether it's COVID-19 or just a cold or the flu or whatnot. Certainly, if there's gaps in an investigation, just like we have been, we will alert the public, let them know of the gaps. This does not mean you had direct contact with any individual at these employers. This is really more or less to alert you. When we don't receive a lot of people calling in saying, I'm now sick because I went to the Walgreens on this date or that date, but it's more of informational to let everyone in the community know it's here. Please be cognizant of your symptoms every day, no matter what the scenario is. Please take your temperature every day. And if you have children, please take their temperatures every day. We have community spread of a virus that we don't have the ability to treat effectively at this time, so we need your help with that. Positive cases, again, we had a good day of releases from mandatory isolation. We've set up and utilized technology for people to put their symptoms online and start putting those in a data log online. Once you do that, rest assured we're going to review that, and when you get to the point with the guidance allows us to release you, we will. I'm just asking for our positive patients that when you're putting that in, please don't call the health department right after every day and do that. We're looking at that. We want to be able to release you and get you out of mandatory isolation. We understand the sacrifices you've made for the community. We value that. We appreciate that. But by calling the health department and inundating them with unnecessary calls, that actually slows down their process of being able to release you. So thank you for that. Again, also please text message as necessary with our health department nurses. That's very important, and this helps us out in that process. Again, you're only going to get an official release from our health department. Even if you're following the guidance, you understand the rules and regs, until you get that release from us, you're still in mandatory isolation. Thank you. Certainly social distancing, we're talking a lot about this. There's various metrics that are looking at. Our county and counties around us have improved since that those essentially orders have gone in place. I want to thank the community for responding. Today's a fantastic day to social distance. The next few days are as well. We really need people to take this seriously. We're now at a point where we ask the community to sacrifice for a 2-week period. We're now 4 days into this. We really have 10 days left. What we do over these next 10 days by staying away from each other, by really minimizing our commercial spending habits outside of the house or going to any parks, by really minimizing that by 60%, not 50 anymore. We're going for our own curve by 60%. By doing that now will help us get better data than what we've been getting really a week and a half and 2 weeks from now. So for everybody who hasn't bought into this, who is skeptical of everything, I just ask, even if you're skeptical and you think you don't believe that this is a big deal, if you want to get back to what the new normal looks like faster, then we need you to buy into this for the next 10 days. Certainly, I want to remind people, and we're getting a lot of this, that for our families who are separated, meaning there's custody arrangements, this is I'm really just imploring you to buy into the social distancing. We're getting a lot of different parents who are extremely concerned when their children are not with them and they're in the custody arrangement, that their mom or dad isn't taking this as serious as they need to. Please do. This is just, right now, there's enough stress going on. Please take this serious. Certainly, we're keeping family court advised to the call logs we're getting related to this, and that's something that we can't solve for anybody, but we're passing on this information to family court, and if they feel that there's the problem's big enough, they may intervene themselves. Also related to that, certainly we were excited today with Upstate being able to get their on-site testing done. That's a big thing for the community. There are capacity constraints, but for them to be able to use their lab and turn around information within a day gives us probably another 24 to 36 hours to do our investigation and identify and quarantine faster. This is a big thing for our community. For them to be able to rapid test their employees or people who are hospitalized. That's not open to the public at large now, but that again is a really effective tool that helps us overall in the community. So congratulations to our partners at Upstate there. Yesterday we heard from Dr. Gupta a story and a passionate plea to the community. It's frustrating for my health department to go through their investigations and see some of the things they're seeing because they are preventable. And we're going into a scenario this weekend where many of the things that have happened with family get-togethers that have led to cases, I'm very concerned about will happen again. I've had many calls today from many restaurants about large catering orders they've received. Certainly, that is a sign that some people aren't taking this seriously, and I ask you to just think this thing through. Getting together of over 10 people is not advisable to begin with, but even getting together with people outside, even if they're in your family, outside of your household, is something that we recommend not doing. This is really serious. Mom and dad are at risk to this. When you look at people who are getting very sick, it's hitting certainly our senior demographics harder than other demographics. This is just, we're asking for your help and your common sense at this point. We've told you about cases. We've had cases where people have been in social gatherings, recreational, and it's led to spread. We've had other cases where people have brought food and whatnot to areas that has led to spread. And now we're talking about religious holidays, the biggest weekend for many of our religions, but we can't celebrate it the way we would normally do that. And so I just ask for your common sense with this. We fear that some of the progress in this data that we're talking about today can go the other way because of an afternoon around the dinner table when these things could be avoided. So I ask for your cooperation and your consideration. Again, our voluntary shelter in place, we're 4 days in. The Unicast data, so our partners in other counties around us have joined us in this plea to the residents. The Unicast data has gotten better for our counties around us. Our updated score wasn't ready yet. I would assume our score will go high today because it's messy outside, but certainly we'll be watching our scores when it gets a little bit nicer, but we really need to take this seriously. The actions today, again, are going to drive outcomes down the road, and I know people are getting anxious and antsy. They're seeing reports about the curve in New York State flattening and the curve in the country flattening. Many of these algorithms have been false to our betterment as a country and as a state compared to worst case scenario. But in our situation, now is not the time to get lax, because the data today does not suggest we can restart anything. The data needs to improve before a restart. And by the way, through the end of April, the federal government and the state government have already essentially shut things down anyways. So I just think people need to realize we got a lot of work to do here before we can get to where everybody wants to get to. And once we talk about a restart, it's not going to all happen at once either. It's going to be a phased-in approach because people are very concerned about a potential resurgence with this virus if you move too fast. So saying that, Plasma Project, again, Upstate and the Red Cross, you who are positive have the ability to help our community in ways that those of us that haven't been positive don't. so please consider being part of that project. Our upstate triage line, 315-464-3979. If you have no insurance, you need screening, you're sick, to see if you need COVID-19 testing, call that. It's also been a referral source for primary care providers to refer clients to get testing as well. That testing then goes down at the Syracuse Community Health Center. Our seniors, healthcare workers, and adult nutrition hotline, 315-218-1987. This has been a hotline we set up early on to meet the needs of our community with individuals, independent seniors who we're asking to stay home. If we're asking them to stay home, we got to help them do some things they need help with. Our healthcare workers are working across the board. If they can't get to the grocery store for items, we need to help them. That's what this is there for. Child Care Solutions. This is our daycare program we've had in this since this process began. Through the month of April, free daycare for our essential business employees. If you run into gaps in your child care, emergencies pop up. We don't want grandma or grandpa or an aunt or uncle being the daycare provider as much as they want to see the kids. It's better that they don't see the kids and we hunker down for 10 days here to starve this virus. Vera House support. There's never any excuse for abuse. Phone number 315-468-3260. If you're in a situation that you're uncomfortable with at home, please contact this number, talk to Vera House, get help. Again, on the same note, McMahon Ryan Child Advocacy site for reporting any concerns related to child abuse or any support systems for children, 315-701-2985. Many of our mandatory responders related to issues with our children, our teachers. There are no kids are home, they're not in school. This is a challenge for this. Donations of PPE, this is still an ongoing issue in the community across the country. If you have the ability to give us PPE, no matter what the quantities are, we're very thankful for you. 315-435-2525. Our veterans, we're still here. If you need help with caseloads or whatnot, please contact us, 315-435-3219. And again, 211, our mental health is being challenged. I want to give a big shout out to all of our mental health professionals who are really working hard as well in this process. A lot of people who have not needed your guidance and assistance are now reaching out to you. So thank you for all of your efforts. It's very much appreciated. And again, you can call 211 if you need to talk to somebody, work on strategies related to mental health. Saying that, we can certainly take some questions.
Friday, and you got to the good news early, and I don't want it to be understated that the number of recoveries today outpaced the number of positive cases.
Yeah, I think so. I think if I'm looking at let's go through the negatives first, okay, and we'll end with some positives, what I see in the data. Negatives, 49 hospitalizations, that's the highest we've had, 18% of active cases, 25 ICU cases, 9%, and then a eighth victim in our community passing away. I think what these percentages are, why everyone needs to take this seriously, is because this virus is very effective in getting our residents sick. And so 18% of active cases in the hospital, that's not good. So it's very, very potent. This isn't the flu. This is much worse. That's why people need to take this really, really seriously. But when we look at some positive trends, more recoveries than positive cases, that's big. We've talked about that needing to be sustainable. We've talked about only 300 outstanding tests, receiving 435 tests with only 14 positives. That's new, and having only 300 outstanding tests. We haven't had that number that low in weeks. So remember, out of that 300, not all of them are county residents. So say maybe 10% of that number, maybe is outside the county. You're at 270. So depending on the demand today, we could see ourselves, get caught up for testing in real time, which gives our health department more ability to quarantine and treat. But also I've been talking about this as a data point that we needed to see, that I look at this data point. The other third big thing that's going to help us is upstate's testing. That's another real positive here that I see. Be able to turn things around in 24 hours, for them to be able to internally do rapid testing will help. The PPE that they use internally, that will help their PPE burn rates. So it's not just the testing, but it's the supply chain that helps. So there's some, the negative news reinforces what we're saying, why we're doing what we're doing. Even if the active cases start to shrink, the people who have this that get sick get really sick. The positive news is that some of the things we've been looking for, we started to see a little bit.
And in your wildest dreams, did you ever think it would be a restaurant to tip you off that says, we got a catering order that's too big and it's scaring us?
Well, I think what you see, Andrew, is kind of a lot of these employers and people that work for these employers are really alarmed by some of the behavior of the general public. And again, I think I think half the public is doing more than what they need to do. They're fantastic. 40% are kind of doing what they need to do, and it's that 10% still that we have that aren't buying in, or maybe you're starting to a little bit begrudgingly. Begrudgingly buying in is okay. We just need you to buy in. And people are alarmed, and we had people who work on the frontline stores alarmed by the behavior there, and they're the workers reaching out to us. We have people who are going to have a pretty good day business-wise, but alarmed by the quantities that they're being asked to prepare, and saying this is contrary. Now, they're not telling us this family is doing this or that, but nor are we really asking, because that's just too hard to police this kind of thing. But I guess if we're telling you and sharing with you information based off of positive cases this week. These are people this week. That means they got sick last week. How they got sick? They got sick by going and having dinner with mom and dad, then going and hanging out with their friends. They got sick playing cards. They got sick maybe doing something recreational outdoors. We're telling you different cases of how people are getting sick, and then educating you and telling you this can happen to you. And if it happens to you and you are positive, there is an 18% chance you'll be in the hospital. And if it happens to you, and it happens to someone who you love, and they're one of our seniors, they have a chance to be one of the 9% in the ICU bed. So we're telling you this is what's going on. So please don't let it be you or your family. Please don't.
What's the biggest restaurant order they told you about?
I mean, Tim, I know how much I can eat on a holiday, and I can go toe to toe with anybody. But some of these orders were certainly, you would assume there would be a gathering of more than 10 people. Let's put it that way. So that's troubling.
How many, is it different restaurants? This is fascinating in a bad way, because this is really, useful data.
We know.
Are there more than one restaurant?
Look, I know when you have takeout, many people are looking at takeout being an option instead of cooking, right? You want to celebrate, relax. We have not, in my household, figured out what we're going to do for a meal. Normally, my mom's cooking, and so now Kate and I are on the hook here. I can tell you I won't be cooking, but so we may do takeout too. But I'm telling the world, it will be me, Kate, Andrew, Jack, and Maddie at the house. And so I get the need to want to be together with family. I'm in the same boat. I want to do it too. I just can't. We just can't. We just can't.
Did more than one restaurant call you?
Yes.
How many?
Half a dozen or so.
They picked up the phone on their own accord and said, Ryan, you need to know that our orders are
This
the
is what
same."
we're seeing. Yeah.
I know we've seen a bunch of like birthday parades and things like that. Do you still encourage people to do that, or would you tell people not to?
Yeah, it's all about a balance. So I'll give you an example. Some of these parades are happening. They're asking for the local fire departments to be involved with them. We've asked the fire departments not to. Why? We don't want to be a Debbie Downer. We know the kids love seeing the fire trucks. It's risk mitigation. We can't have our fire departments put themselves in any sort of harm's way that's unnecessary. We can't have a fire department going out with COVID and then having fires in that community and having our response times suffer at that. So if you go through a driving birthday parade and you don't get out of your car and you guys, that's what it is, and you're honking, I get it. I get it. I've had people email me asking permission. So I get it, but we can't have the first responders part of those parades. I had a call this morning with them, asked them not to do it, even though, because they're getting people asking. I heard in the town next door, the fire department was there. So I don't want to be the bearer of bad news, which sometimes I am, but we just can't. It's all about risk mitigation at this point. And we're asking everybody to be very, very conservative with the most important thing in your life. That's your health.
Ryan, could you talk a little bit more about your hope that we get to a point of testing in real time?
Yeah.
How close are we to that, and what kind of capacity does upstate have?
Yeah. So my understanding, and again, we're just learning this. I think you may have broke this story, Tim, or someone in your outfit, that they have the capacity to do about 100 or 150 tests at the lab a day. That's good. Their rapid testing, I think the capacity is lower. That's why they needed to use that for internal. It will help them make internal decisions, which is very good. Certainly, we would love the ability to do rapid testing and incorporate that into whatever a restart looks like. But I can tell you this, if we're in a situation where we're not waiting on hundreds of tests a day, our health department, that allows, based off of percentages, us to, when we have cases, test and quarantine very quickly. That's if you're waiting on 50 tests a day, that's something that's very manageable with our health department. So certainly these are good things. These are really good trends. These are some of the things that we've wanted to see desperately. We got them now for one day. So let's see if we can get them again tomorrow.
You keep talking about how the medical infrastructure is helping the whole region. And maybe the numbers here in Onondaga County are slowing down, but it looks like some of the other counties are going up. Does that concern you?
I think in the other counties it's because they've really started doing testing. Okay, we were basically their only testing source before. I know Madison's got a mobile testing site. Cayuga started to do more testing. We've always done this testing every day. We've never shut it down. You got to qualify for a test, right? I can't just go get a test. Somebody asked me that question one day. I'm not sick. I'm not getting a test. So they've done. I know in Cayuga they've had a more concerted effort with testing. We've been in touch with their leadership there. So I think that's kind of why you've seen it. More that they're just identifying positives that were probably there to begin with. But this has to be a regional approach. That's why I'm happy that they've really bought into some of the things we're doing, because we're connected. So many of us go into each other's communities. So many of our schools are connected. We have BOCES programs with Cayuga County, and some of our schools with Oswego County, and I believe Madison County as well. So we're connected that way. We're connected via employment. We're connected via commercial spending. So we all really need to be practicing the same things.
Ryan, I know the hospitals are under a lot of financial strain. Do Do you know of any efforts to bring more state or financial or federal aid
Yeah.
to help them?
Tim, I know that the federal money from one of the stimuluses started to flow to the 3 local hospitals today. I'm not sure the exact amounts they received, but I know that some of I had a call with Congressman Katko. He was telling me that that was happening. Certainly, if PPE wasn't an issue, we could probably have a conversation about elective surgeries again. But right now, PPE is still an issue. And I think at some point, if we still have the capacity in the hospital beds, we've always said about helping out other parts of the state. If we have hospital bed capacity, we would rather take in people to utilize that capacity than break up our infrastructure. So I think at some point we'll probably see some patients from outside the community come in and utilize some of those beds, which helps the hospitals get some revenue.
So far, we haven't seen that.
I don't think so. I think that might be coming. We'll report on when and if that happens.
I interviewed Mayor Walsh today about the results of the loan program in the city of Syracuse. 29 small businesses in Syracuse were awarded a total of $500,000. What's the status of the county's program? It's a little different.
Yeah.
It's that GAP loan, but what's the status of that
Yeah,
program?
so we had over 30 applications. OCDC, our Civic Development Corporation, is administering it. We're using their funds for a bridge loan. So that board is going to meet and make some awards. One of the things too, Andrew, that's happening is I know the state's looking at loosening up rules for IDAs, that IDAs could potentially give loans. We would then look at an IDA loan program, trying to fill the gaps with the SBA loan right now that is really pumping a lot of money into our community. That's one of the things Congressman Katko and I talked about. And so you have that program, which is what anybody who qualifies should really go there first. And then you have the SETCO, you have our bridge loan and partner there. But then we're looking at what are the other gaps that people need help that couldn't qualify for whatever reasons. Can we help fill those gaps? So that's what we're looking at. The idea being that a lot of these businesses who got shut down, they didn't get shut down because of a bad business decision. They got shut down because we have a pandemic. So what can we do to help them stay afloat, pay the bills, maybe keep some people on the payroll, knowing to make sure they reopen? Because if they reopen, our community is going to rally. And we're going to rally around our local businesses, and then they're going to bring back their employees.
Ryan, I think a lot of people were shocked to see that a baby just 3.5 months old in Cayuga County contracted COVID. What's the picture with our, in terms of young children here? Have we seen anything?
Yeah, we have 2 under 10, and none in that demographic. We had
None that young.
Yeah, we had a contact, which we knew was going to happen, right? So mom or dad gets it. Eventually, the kid's going to get it. And then we had another one under 10 involved, I think we said, with a play date. Again, most part, parents have been fantastic about play dates. Not going to complain that we got one this far along related to that. Parents have been very good about keeping young kids away from everybody else. So I want to thank all our parents for that. The data proves the great job you're doing.
So far, just 2 kids under 10 that you know of.
Yeah.
And both are sounds like.
Yeah, and the other cases, I think we're 14 and up. And so you had even our 14-year-old, I think that case was affiliated with travel. And so had a scenario where this is not impacting children. Our timing related to closing schools was right on. That certainly helped. Certainly the university's participation in doing what they did, as painful as it was to the economy, it's probably helped sustain our medical infrastructure. So the Chancellor and President Lemura and Dr. Crable and ESF, that has helped tremendously.
Is there anything we've learned really recently? It's kind of a vague question, but I feel like even economically, as this progresses, we find a new problem. You mentioned gaps. We find something new that we didn't think would be a problem 3 weeks ago, 2 weeks ago. Anything new come across your desk that you're like, wow, that's going to be a problem?
We talked about custody arrangements. I think that's one of the big ones we're seeing now. Mom and dad are split up, and mom's taking social distancing seriously, dad's not. And they're looking for help. They're looking for me to do something about it. I want to do something about it. I can't. That's what the courts are there for. This is becoming a real problem, and people are very scared. And so, we feel the anxiety at every level, Andrew. Wearing masks, that helps people with their anxiety when they're out wearing a mask. Employers getting masks for their employees. A, your employees want one because they're emailing me, but B, that helps with the anxiety with everybody else in the community. So there's various things that are still, we're hearing about. I think everybody's trying to do their best, but certainly there's things that we still can do to help tamper down that anxiety. And we've been at this now for a little while, right? I mean, it's essentially a month, and I think overall we've done pretty good. It's just focusing in on the things we can control, and some of the things we can control can lead to lesser cases moving forward, and then that allows us to look at really what the next phase of this is, not the public health emergency, but how we can balance the public health with restarting our economy.
You mentioned that PPE is still in short supply. Have you experienced the state or federal government hijacking any of your...
I'd have to check, Tim. I think at one point we had an order that was intercepted for a larger government. I think you run into lots of things. You got lots of new players here. For us, we're not going to go wire somebody in Mexico $500,000 like they want us to. But we have to then, whoever takes a PO, a purchase order, that's who we then do business with. We order something, it comes in and it doesn't pass inspection, we don't pay for it, we send it back, we got to do it all over again. So these are the things that I think are happening with governments. Reliable PPE that passes a fit test that our medical providers can actually use. So it's not as bad. It's not the Wild West like it was 2 weeks ago, but your reliable sources, there's such demand that you're waiting. So it's a constant struggle to be on top of it, which it shows you there's a lot of business opportunities when this is said and done in this field. If there is not a manufacturer of PPE N95 masks in the United States of America, shame on all of the entrepreneurs, because when everybody's buying them from China and Italy, not a good idea to do that anymore. We're going to be using these N95s every day forever, because we always are going to have sick people. So there's a lot of, after this, there's going to be a lot of economic opportunities, and I think our country is going to learn a very big lesson from this.
Which order of yours was I don't know what the word is, hijacked?
I'm guessing N95s. I want to say that these are so in demand that I think maybe we had one order at one point that either FEMA or the state got in front of us. I know at one point we were trying to get more ventilators, and the state ended up getting them. And then we feel pretty good where we stand with that now. So when we've been getting leads, we've been giving them to the state. I think the state feels better where they are right now with the ventilators now. So ventilators I don't think are the issue anymore. I think actually the manufacturing of them is going to help the rest of the country as well. We saw what JMA did yesterday, very, very fantastic. But your simple face masks, who would have thought that we'd be in this situation?
I know you're talking about the custody problems and people are reaching out to you. Who would you advise them to call or reach out to if they are having a problem?
Yeah, they got to look at its family court, and it's, we've contacted family court saying we're seeing a lot of this. they have a challenge too because of the way that they have their court schedule now. But again, we're seeing a lot of this. And how do you, as a family court judge, I mean, how do you, what kind of guidance do you have? Social distancing has never been an issue that you battle over custody, right? So this is one of the things that it's all brand new and everybody's adapting and doing their best in the process.
Is there more you can do with that tip from caterers? Can you send deputies to parking lots of restaurants to follow people home with boxes of food?
I mean, that's not something we're probably going to do, Andrew. But there's nothing wrong with me highlighting this on television that this is happening. We know it's happening, and it's just, why are we doing it? Just please don't get mom and dad sick. Don't. I don't know. It's happening. Well-intentioned things that were absolutely normal and are okay pre-COVID. Right now, in the heat of COVID, it's not okay. Just stop. Any other questions? We're happy they're going to the restaurants. We just don't want people having big parties.
Maybe they can donate those orders now to hospitals.
Listen, if they certainly reassess their decision and they still want to donate some of that food, we can help them. Other questions? Okay, I got to give a big shout out to Elder Clay of the Church of Jesus Christ of Latter-day Saints. Earlier this year, the Church of Jesus Christ of Latter-day Saints gave the city and the county a bunch of food. Many of you reported on that. We had a huge case, just a tremendous amount of truckloads of toiletries and food that they brought in and helped us get out to the rescue mission, the food bank. When this crisis happened, we reached back out to them, and they came in a big way again, and they donated truckloads of food, toiletries, and household products. Again, we couldn't ask for better friends and partners. It's just another example of people rallying in this community, and for them to do this twice now for us in 1 year. They did it the first time based off our focus on the issue of poverty. I went back to them on a limb, and boy, did they step up. So again, I want to thank the Church of Jesus Christ of Latter-day Saints, their local delegation, and Elder Clay for your leadership and your friendship in this time of need. Thank you, and we'll see you tomorrow.